Hi, I'm Dr. Patrick Foy. I'm an MD or medical doctor, and I'm the director of the Coccyx Pain Center or Tailbone Pain Center here in the United States, online at tailbonedoctor.com. This video is about tailbone dislocations. This video is the next in my series of videos going chapter by chapter through my book, Tailbone Pain Relief Now. The idea of the videos is to give you, some sense of what's covered in each of the individual chapters, and also in this format to provide a way for us to interact about the topic. So you can post comments and questions and your experiences down below this video if you have things to say about tailbone dislocations, coccyx dislocations. This is chapter 8 within my book. And the most important thing with tailbone dislocations often is to distinguish a dislocation from a fracture. And these are very, very different. And if you think about it, a tailbone dislocation is when one bone is no longer lined up and attached to the next bone. So I'll show you that here. This would be, here's an image from my book. This would be showing a partial dislocation where this bone is no longer lined up with the bone beneath it. It's almost a complete dislocation in this illustration here. But the thing I'll call your attention to is that each of the individual bony segments is intact. None of those are broken. So that's very different than a fracture where there's a crack in the bone or a chip off the bone. In this example with a dislocation, by contrast here, there is no chip in the bone, there is no crack in the bone. Each individual bony segment is intact. So it's not a fracture. This is a dislocation. It's very, very common that I see this mistake made by emergency room physicians or primary care doctors or even by musculoskeletal physicians or radiologists who should know better and would know better in other parts of the body. But what they'll do is they will see this separation here between one bone and the next, and because they think of the tailbone as being a singular bone rather than a series of bones, they'll think, oh, well, this segment must have fractured off that one above. But that's not how we make a diagnosis of a fracture versus a dislocation. We look to see, is the individual bone itself intact? And that becomes important because it's important in terms of having an accurate diagnosis first, so that then you can decide what you need to do or not, or don't need to do in terms of your treatment options. The way that you diagnose a dislocation at the tailbone is typically after your history, and your physical examination is imaging studies. Often X-rays will be able to make this determination, especially if you can get sitting versus standing X-rays, because there are times where the patient will have something that looks normal in one position, but when they're sitting, which is their painful position, they may have a dislocation that only appears while they are sitting. That's called dynamic instability, which is one of the other chapters in the book, which I've covered in another video as well. So the idea about the dislocations is that you want to make an accurate diagnosis and you want to know exactly what joint is dislocating, so that if treatments are being provided in the form of injections or things of that nature, that the physician should know where to target any such procedure or any such injection, or in severe cases of small percentage of the time that needs surgery, that the surgeon needs to make sure that he or she has taken care of the area where you're actually having the dislocation. So that becomes really important. Again, dislocations can be very common at the tailbone. They can be very, very challenging to treat, and you need the proper imaging studies in order to make the diagnosis in the first place. If the proper imaging studies aren't done, then often the patient unfortunately is told everything was normal, everything looked fine, there's nothing wrong with your tailbone, when really you have a dislocation or some other injury or problem. What is it that causes the dislocation? Well, basically, it's a problem with the ligaments. Normally, ligaments are what hold one bony segment to the next, whether that's here in my fingers or in the bones of the coccyx. The ligaments span from one bone to the next bone. And if those ligaments are stretched or torn, then you no longer have that stable connection holding one bone to the next, and then the bones will shift or move, which is, again, by definition, a dislocation. There's a lot more in the book in terms of the appropriate tests to get, and there's a whole, the whole second half of the book is about different treatment options. But hopefully you have a sense now, at least, of how to distinguish a dislocation from a fracture, and understand what a dislocation is, and also understand that some dislocations only show up on the x-rays while you're actually sitting and putting your body weight onto it, which is why it's important to have the sitting or seated x-rays performed. I hope that information is helpful for you. If you're looking for a copy of the full book, the easiest way to get that is to go to www.tailbonebook.com. And on there I have the links to all the different Amazon pages for the different countries that you may, whatever country you may be in. You can get either the paperback copy, it's 272 pages, or you can get the electronic copy of the book, the ebook, which you can download that worldwide. Any place where you have an internet access, you can get the book that way if that works best for you. So post your comments down below. I'll be interested to read those and see your thoughts or comments. If you've been told you had a dislocation, but they never did the imaging studies, which would be crazy, or if you were told you didn't have a dislocation, but the imaging studies showed you actually did, or they never did the proper tests, or what have you. Post your comments or questions down below. If you're looking to find me online or to come for an evaluation here at the Coccyx Pain Center, the easiest way to find me is to just go to my website, which is www.tailbonedoctor.com. Okay, bye-bye now.